Welcome to this in-depth and vital topic on end-stage renal disease (ESRD). For millions of people across the globe, especially in the United States, facing a diagnosis of end-stage kidney failure means standing before one of the most profound medical decisions of their lives, choosing kidney replacement therapy. This decision is more than just a medical choice. It represents a drastic lifestyle transformation, impacting every aspect from physical and mental health to finances and social relationships. In this specialized topic, we will together explore two primary treatment methods, two distinct paths that nonetheless offer hope and life to those with end-stage kidney disease, dialysis, and kidney transplantation. Our goal is to equip you with comprehensive knowledge so you can confidently ask questions, discuss with your healthcare team, and make the most informed decision for yourself or a loved one. It's crucial to emphasize that this content is for informational and educational purposes only, and is not a substitute for personal medical advice. All treatment decisions should be thoroughly discussed with your doctor or healthcare professional. To understand why dialysis and kidney transplantation become necessary, we must begin by grasping the essential role of the kidneys in the body. The kidneys are two small bean-shaped organs located just below the rib cage on either side of the spine. Despite their modest size, they are incredibly sophisticated and efficient blood filtering and internal balance homeostasis maintenance systems. Their main functions include filtering waste products and toxins from the blood, such as urea, creatinine, and uric acid, while retaining essential nutrients and proteins. They also regulate water and electrolyte levels like sodium, potassium, calcium, and phosphorus to maintain the balance necessary for nerve, muscle, and cardiovascular function. Furthermore, kidneys produce essential hormones like erythropoietin (EPO), which stimulates red blood cell production, renin, involved in blood pressure regulation, and calcitriol, an active form of vitamin D crucial for calcium and phosphorus absorption, thereby maintaining bone health. When the kidneys are damaged and lose their ability to perform these functions, effectively waste products and toxins accumulate in the blood, leading to chronic kidney disease, CKD. CKD often progresses silently through many stages without clear symptoms. As the disease advances to its final stage, known as end-stage renal disease, ESRD, kidney function is almost completely lost, making it impossible for the body to sustain life without medical intervention. Many factors can lead to ESRD, with diabetes, especially uncontrolled type 1 and type 2, being the leading cause in the United States, accounting for about 44% of cases. Prolonged high blood sugar levels severely damage the small blood vessels in the kidneys, gradually impairing their filtering ability. The second most common cause is high blood pressure, hypertension, responsible for approximately 29% of cases. Chronic high blood pressure narrows and hardens blood vessels, including those supplying the kidneys, leading to structural damage. Other causes include glomerulonephritis, a group of diseases that inflame the kidney's filtering units; polycystic kidney disease (PKD), a genetic disorder causing fluid-filled cysts to destroy healthy kidney tissue; chronic urinary tract obstruction from recurrent kidney stones or an enlarged prostate; and systemic autoimmune diseases like systemic lupus erythematosus. As ESRD progresses, symptoms become more apparent, which can include severe fatigue and weakness, swelling in the legs, feet, ankles, or face, due to fluid retention, nausea, and loss of appetite; difficulty sleeping, muscle cramps, or twitching dry and intensely itchy skin; shortness of breath due to fluid buildup in the lungs; decreased urine output; and difficulty concentrating or confusion. When these symptoms become life-threatening, medical intervention to replace kidney function is necessary, primarily through dialysis or kidney transplantation. Dialysis, or blood purification, is a medical process that replaces the blood filtering function of the kidneys when they can no longer perform it on their own, essentially sustaining the lives of millions. It removes waste products, salts, and excess fluid, while helping to control blood pressure and balance critical blood chemicals like potassium, sodium, and calcium. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis. The most common type uses an external machine called a dialyzer, or artificial kidney. Blood is drawn from your body through a special vascular access pumped through the dialyzer, where it passes through semi-permeable membranes, and cleansed as waste and excess fluid diffuse into a special cleansing solution called dialysate. The cleaned blood is then returned to your body. To facilitate this process, patients require a vascular access, and three main types are used. A fistula created by surgically connecting an artery, and a vein is the best and most durable option, though it requires weeks to months to mature. A graft involves implanting a synthetic tube to connect an artery and a vein usable sooner, but with higher risks of infection and clotting. And a catheter. A soft tube placed in a large vein is typically for temporary or emergency use, due to its highest risk of infection and clotting. In-center hemodialysis is usually performed 3 times a week, with each session lasting 3 to 5 hours, during which patients are closely monitored by medical staff. This offers continuous expert supervision and a chance to connect with other patients, though it comes with fixed schedules, travel time, and common post-dialysis fatigue and exhaustion. John, for instance, a 62-year-old patient who has been on in-center dialysis for 5 years, shared, "Having to go to the center 3 times a week is truly exhausting, and I often need the whole afternoon afterward to recover. But I feel safe knowing there are always nurses by my side." With advancements in technology, home hemodialysis has become a viable option for some patients, allowing them to perform shorter, more frequent sessions, e.g., 2 to 3 hours 5 to 7 times a week at home after thorough training. This offers significant flexibility, reduces discomforting symptoms, and improves quality of life by maintaining more stable waste levels and reducing blood pressure fluctuations. However, it demands high patient responsibility, dedicated home space for equipment, and often requires a caregiver. Susan, a 50-year-old patient who switched to home hemodialysis, noted, "I have so much more energy and I can work during the day without interruption. It has truly given me my life back." Regardless of the hemodialysis type, strict adherence to a dietitian-designed diet and fluid management is critical, involving limiting liquids, sodium, potassium, which can be dangerous to the heart at high levels, and phosphorus, which can harm bones and blood vessels, while carefully managing protein intake. Peritoneal dialysis (PD) offers another approach, utilizing the lining of your abdomen, the peritoneal membrane, as a natural filter. This method is often preferred for its flexibility and home-based nature. A minor surgical procedure places a permanent catheter into your abdomen. PD works by filling the peritoneal cavity with a special dialysate solution, allowing waste and excess fluid from your blood to diffuse into the solution during a dwell time of several hours before the waste-filled solution is drained and discarded. There are 2 main variations: continuous ambulatory peritoneal dialysis, CAPD, which involves manual exchanges throughout the day, typically 3 to 5 times, allowing patients significant autonomy and the ability to maintain their work or study schedules. And automated peritoneal dialysis, APD, which uses a cycler machine to perform multiple exchanges automatically overnight, while the patient sleeps, offering greater daytime freedom. PD offers significant flexibility compared to in-center hemodialysis, being performable at home or work, and is considered gentler, more continuous, and potentially better for preserving residual kidney function, with no need for frequent needle sticks. However, a primary concern is the risk of infection, especially peritonitis, which requires extremely strict hygiene protocols and thorough training for the patient and caregiver. Other drawbacks include the need for significant home storage space for supplies, potential discomfort from the catheter or a distended abdomen, and some protein loss through the dialysate. Mark, 38, a programmer, chose PD, stating, "I didn't want my life to be tied to a hospital schedule. With PD, I can dialyze while I sleep and still work normally during the day." While both hemodialysis and peritoneal dialysis are life-sustaining, they are only replacement therapies, not cures for kidney disease, and they do not fully replicate all the complex functions of natural kidneys. This leads us to another option that can offer a near-normal life: kidney transplantation. A kidney transplant involves surgically placing a healthy kidney from a donor into a recipient's body to replace their failing kidneys. For many ESRD patients, it's considered the best treatment for a significantly higher quality of life and extended lifespan. Donated kidneys can come from living donors, often family members, close friends, or altruistic strangers who undergo rigorous health evaluations. Living donor kidneys are preferred due to better outcomes, shorter or no waiting times, quicker post-surgical function, and higher long-term success rates. Paired exchange programs even facilitate compatibility. Kidneys from deceased donors, managed by systems like UNOS in the US, are allocated based on factors like blood type, tissue type, HLA, match, immune sensitivity, age, waiting time, and geography to ensure fairness and success, though finding a match can take months to years. The preparation for a kidney transplant is a long and complex journey, beginning with an initial evaluation by a medical team to assess suitability, involving thorough health checks, comprehensive blood and urine tests, cardiac evaluation, cancer screening, and psychosocial assessment, to ensure the patient can withstand surgery and lifelong immunosuppression. If eligible, the patient is placed on a national waiting list for a deceased donor kidney. Once a suitable kidney is found, surgery places the new kidney in the lower abdomen, typically leaving the native kidneys unless medically necessary. The new kidney's blood vessels are connected to the recipient's and its ureter to the bladder. Post-surgery recovery involves a hospital stay of several days to a week, followed by close and frequent monitoring to ensure the new kidney functions well and shows no signs of rejection. A critical aspect of kidney transplantation is lifelong immunosuppressant medication. These drugs prevent the immune system from attacking and rejecting the new kidney and missing doses, or stopping medication significantly increases rejection risk. While vital, these medications come with potential side effects, including an increased risk of infections due to a weakened immune system, certain cancers, especially skin and lymphoma, new onset diabetes after transplant, NODAT, high blood pressure, weight gain, osteoporosis, and other kidney issues. Doctors carefully adjust dosages to balance rejection prevention and side effect minimization, requiring regular blood tests. The primary advantage of a kidney transplant is a significantly improved quality of life. Patients often experience more energy, freedom from dialysis machines, and much greater dietary flexibility. Transplantation generally offers a substantially longer lifespan compared to ongoing dialysis, with 5-year survival rates for living donor kidney recipients around 85–90%, and for deceased donor recipients 75–80%. A transplanted kidney can function effectively for an average of 15–20 years for living donor kidneys and 10–15 years for deceased donor kidneys, though this varies individually. Transplants also remove the time constraints of dialysis, allowing greater freedom in work travel and social activities, and improve overall health by reducing risks of ESRD-related complications like cardiovascular disease, anemia, and bone disease. Sarah, 45, who had a kidney transplant 2 years ago, shared, "I feel like I've been born again. I can go hiking, spend time with my children and grandchildren without worrying about dialysis schedules. Even though I have to take medication every day, it's a small price for the life I have." However, transplantation also carries its own set of challenges. It is a major surgery with inherent risks like infection, bleeding, blood clots, and anesthesia reactions. The significant risk of rejection persists even with immunosuppressant medication. Rejection can be acute, weeks to months post-op, or chronic, slowly over years, potentially leading to graft failure and a return to dialysis or retransplantation. The side effects of immunosuppressants are a major concern, causing severe health issues such as increased susceptibility to serious infections, requiring special vaccinations, and avoiding sick individuals, skin cancer and lymphoma, new onset diabetes, high blood pressure, weight gain, osteoporosis, cataracts, and other kidney problems. Post-transplant, a careful diet and lifestyle are still necessary. While more flexible, a healthy diet low in salt with controlled sugar and fat, regular exercise, and avoiding risky behaviors like smoking are vital to protect the new kidney and manage medication side effects. Finally, the financial cost can be very high, potentially over $400,000 for the entire transplant process. However, in the long term, total healthcare costs, including medications for transplant recipients, are often lower than the ongoing costs of dialysis. In the U.S., Medicare typically covers transplant surgery and a portion of immunosuppressant costs for a limited period, necessitating careful financial planning and insurance research for patients. When directly comparing dialysis and kidney transplantation, the impact on quality of life stands out as a primary consideration. With dialysis, particularly in-center hemodialysis, life often centers around the treatment schedule, demanding 9–15 hours per week at a center, plus travel, significantly restricting daily activities, work, and travel. Fatigue, nausea, and cramps are common post-session, and strict dietary and fluid restrictions pose significant challenges. While PD and home hemodialysis offer more flexibility and self-management, they still carry infection risks and logistical challenges. In contrast, kidney transplantation usually leads to a dramatic improvement in quality of life, offering more energy. the ability to return to work travel and engage in previously restricted activities. Despite the need for a healthy diet and daily immunosuppressants, the newfound freedom and energy typically far outweigh the limitations of dialysis. Statistically, life expectancy also differs significantly. The average lifespan for dialysis patients is considerably lower than for the general population, with a 5-year survival rate around 35–40% in the US. Though this varies with age and health, and cardiovascular complications are the leading cause of death. For transplant recipients, average life expectancy is notably higher, with 5-year survival rates of approximately 85 and 90% for living donor kidneys and 75–80% for deceased donor kidneys. A transplanted kidney can remain effective for an average of 15–20 years, living donor, or 10–15 years deceased donor, after which function may decline, potentially requiring a return to dialysis or another transplant. Financial implications are another crucial factor, particularly within the complex U.S. healthcare system. Dialysis costs are very high, often tens of thousands of dollars annually, though Medicare, Medicaid, or private insurance typically cover most of this, with Medicare coverage beginning after a waiting period for ESRD patients. However, patients still face co-payments and deductibles. Kidney transplant surgery carries a very high initial cost, potentially exceeding $400,000 for the entire process. Long-term, however, the overall healthcare costs for transplant recipients, including medications, are generally lower than the continuous expenses of dialysis. Medicare covers transplant surgery, and under certain conditions, immunosuppressants, for a limited period, underscoring the importance of understanding insurance coverage and financial aid programs. Both modalities carry inherent risks and potential complications. Hemodialysis commonly leads to blood pressure fluctuations, muscle cramps and infections, or clotting in the vascular access, with long-term risks, including cardiovascular disease, bone disease, and anemia. Peritoneal dialysis's most serious risk is peritonitis, a painful infection of the peritoneal membrane, requiring urgent treatment, along with other risks like hernia, hyperglycemia, and weight gain. Kidney transplant surgery itself carries risks of bleeding, infection, and anesthesia reactions. The greatest post-transplant risk is rejection of the new kidney, which, though mitigated by immunosuppressants, remains a concern. Furthermore, immunosuppressant side effects can cause serious issues, including increased infection risk, certain cancers, new-onset diabetes, high blood pressure, weight gain, and osteoporosis. The daily schedule and flexibility offered by each method vary considerably. In-center hemodialysis imposes a very rigid schedule, making full-time work, social activities, or travel challenging. Home hemodialysis and PD conversely offer much greater flexibility, allowing patients to perform dialysis at home at times that fit their schedule, including overnight, fostering a more active lifestyle. For transplant recipients, after an initial recovery period, reliance on a fixed dialysis schedule is eliminated. While daily immunosuppressant adherence and regular follow-up appointments are necessary, the time freedom is generally significantly greater than with dialysis. Dietary and fluid restrictions also present a clear distinction. Dialysis patients must adhere to extremely strict diets, heavily limiting potassium, phosphorus, and sodium, and tightly controlling fluid intake, which demands high discipline and can affect social eating experiences. After a successful kidney transplant, the diet becomes much more flexible, almost normal, though a healthy diet low in salt with controlled sugar and fat and regular exercise are still encouraged to protect the new kidney and manage medication side effects. Clearly, there's no single perfect choice for everyone. Each method has its own advantages and disadvantages, and the decision depends heavily on individual health status, age, coexisting medical conditions, family support, lifestyle, and personal preferences. Making a decision about ESRD treatment is one of the biggest you will face, and it's a personal journey you don't have to undertake alone. You will work closely with a multidisciplinary healthcare team, typically including a nephrologist who leads diagnosis and treatment recommendations, a nurse coordinator who helps manage the process and answers questions, a dietitian who assists with dietary adherence, a social worker who provides emotional and financial support, and for transplant consideration, a transplant surgeon. When discussing with your team, be prepared to ask many questions, such as whether your overall health is suitable for a transplant, which dialysis type fits your lifestyle, your financial ability to cover costs, the availability and role of a caregiver, the impact on your work and daily activities, where to seek psychological support, and what happens if a transplanted kidney is rejected. Actively participating in the decision-making process, asking questions, and expressing your concerns are key. The role of family and your support system is incredibly important. Whether you choose dialysis or transplantation, support from family and friends can be a decisive factor, assisting with appointments, medication, management, meal preparation, or simply providing a listening ear. Share your feelings and worries with loved ones, and consider having a family member attend doctor's appointments with you so they can also understand your situation better. A strong support network not only helps physically, but also reduces psychological burden. In the U.S., many excellent organizations and resources can support you, including the National Kidney Foundation (NKF), which offers comprehensive information and education. The United Network for Organ Sharing (UNOS), managing the National Organ Transplant Allocation System, and the American Association of Kidney Patients (AAKP), a patient-led advocacy group. Participating in support groups both online and in person can also connect you with others sharing similar experiences, offering practical advice. Do not hesitate to seek help from mental health professionals, as coping with chronic illness can be emotionally taxing. Life after an ESRD diagnosis and beginning treatment is a major change, but it is not an end. Self-care is crucial, strictly adhering to your treatment plan, taking all medications as prescribed, monitoring for unusual symptoms, and fully attending medical appointments. Regardless of the method you choose, a healthy diet and appropriate exercise under medical guidance are vital for maintaining overall health and managing coexisting conditions. Always maintain an optimistic and proactive attitude in managing your health. In summary, we have thoroughly explored hemodialysis and kidney transplantation, the two main treatment options for end-stage renal disease. From understanding kidney function and dialysis types to the transplant process and direct comparisons, we hope you now have a clearer view of this journey. The most important takeaway is that you are empowered to make an informed decision. Whichever path you choose, whether dialysis or transplantation, know that a large support community is there for you. Each option offers unique benefits and challenges. The best decision for you will be the one that aligns most closely with your health status, lifestyle, personal values, and support system. Never hesitate to speak openly with your doctor. Ask all your questions and seek a second opinion if needed. Your healthcare team is your most vital partner on this journey. Always take care of your health, and we hope this information helps you in finding the most suitable treatment option.